Hi, this is Dr. Adel from Naperville Family Dental Care with another video log. The subject of this video log is about the top reasons why patients avoid going to their dental appointments. Number one reason, based on surveys, has been fear. Whether it was a fear from their past experience as a child or as a young adult, or even as an adult, or a perceived pain that they think they will have, whether it's based on an experience that they have heard from a colleague or a family member. A lot of those can be averted by better education and also giving patients some control over their appointments, letting them know what to expect in a way. And that comes from better communication from their initial appointment and making sure that they do speak to their dentist about those fears in their initial appointment. The second most common reason is embarrassment. A lot of patients do feel embarrassed about the condition of their mouth, but there's no reason to be embarrassed, even if they've been gone for a long time. I had a patient who had not seen a dentist for 15 years, and the sheer fact that I sat and I listened to her made the world of difference for her. In that sense, it's important to create a wonderful relationship with a dentist or with your care provider to let them know exactly what your fears are and what your expectations are, and also listen back to what the suggestions are from the dentist. So there's no need to be embarrassed. That's what we're there for. We're there to listen and to provide the best solutions that we mutually agree upon. Third reason is cost, and that is a valid one. Even though we found that the majority of patients do have insurance, and many don't, but even with the insurance, there is very limited amount of coverage that is provided, and these were set in the 1950s. The limits that were set, and cost of treatment has changed and has increased because we were able to save more teeth. Those settings or those amounts that were set in 1950s were only set to maybe extract a few teeth and maybe do 1 or 2 cleanings per year. And we are able to provide much more advanced treatment to patients and save many more teeth than they used to in 1950s. Another reason for patients to avoid appointments is convenience, time that they have to take off from work or from their school or from their life and their activities and their social settings. And most of the time, most dentists do provide more morning and evening appointments, some weekend appointments for them, and many times patients can also set some time on the side to be able to ask their employers and to allow them to visit their dentist, because their health is quite important, and most employers do understand that. Lastly, one of the other reasons that patients do miss their appointments is the fact that they have just had lack of concern. Maybe as a child or as a young adult, it was never an experience that they were taught to take care of their mouth, and that comes back from the conditioning that they've had as a child, or where they grew up, and their family, and the importance, whether it was instilled in them from childhood or not. I know from my personal experience that I only went or my family, we only went when there was a problem. There was an abscess tooth, there was an infection, and we never went for preventive care. And this is coming from me. So when we look at that, we find that anyone can break away from their conditioning that they've had from the past with proper education and with proper understanding of how important their oral health is. I hope this has been informative. Feel free to give us a call at 630-369-8950 if you would like to know more about your oral health, and you would like to visit us and get to know us a little bit better. And if you feel free to also leave a comment on the Facebook page. Have a great night.